So this patient does go on to receive doxorubicin and cyclophosphamide followed by docetaxel, trastuzumab, and pertuzumab, and does have a clinical response, and at the time of surgery, in fact, does have a complete pathologic response, which is defined by no invasive disease in either the breast or the lymph nodes. Neoadjuvant therapy is typically used for patients with larger tumors or node-positive tumors, and also if there is an interest in breast-conserving surgery, because the ability to do breast-conserving surgery is much greater in patients that have a significant response, and that's been shown very clearly in HER2-positive breast cancer. Now, in this particular case, there's an added important factor, and that is that the patient has inflammatory breast cancer. And historically, the outcome with surgery up front has been very poor. The recurrence rates are extremely high. So for many, many years now, even before the advent of HER2-targeted therapies, we have been using preoperative chemotherapy for these patients because of the involvement of the dermal lymphatics. And it's very difficult to know where the border of the dermal lymphatics are, if they are only involved right over the tumor or if they go further out, because the clinical changes are quite subtle, the redness and the swelling. So it is very typical now for us to use neoadjuvant chemotherapy for these cases, and obviously in the case of HER2-positive breast cancer, we would now add both antibodies, trastuzumab and pertuzumab. The use of anthracyclines in the initial setting for HER2-positive breast cancer remains somewhat controversial. The data so far actually projects equivalent outcomes from anthracycline or non-anthracycline therapy. If you look at the most important outcome, which is disease-free survival and overall survival, data from the older trials where anthracycline and non-anthracycline therapies were tested side by side show equivalent results. The BCIRG-006 is the study that compared doxorubicin and cyclophosphamide followed by docetaxel along with trastuzumab, or the non-anthracycline regimen of docetaxel, carboplatin, and trastuzumab. So this was in the pre-pertuzumab era, but very clearly the outcomes there were equivalent. So at this point in time, while there are some favorites, some people like to use anthracyclines or feel that it might be more important maybe for younger patients and for higher stage disease, we don't really have clear definitive proof that there's a right or wrong way to go when it comes to using anthracyclines or not.